I don't know how many times we've heard take back control of our borders, our money, our laws. And yet, when Italy locked down 16 million people in the epicenter of the European outbreak of the coronavirus epidemic, tens of planes left Milan and other airports in the area and landed in Britain completely uncontrolled by health officials, swab testing, even the simple thermal temperature records. It's totally insane. And I'm in favor of open borders, but this is a health epidemiological issue for the entire world. You see, their theory is if you let this go through the population
without really taking as many draconian measures,
then
you could sort of take it on the chin, take it all in one go and allow the disease to move through the population.
the problem lies in this: an epidemic will spread automatically unless measures are taken to control it. Up to 20% of the workforce could be off work. Their highest case assumption is 80%. But if 20% of the world's population gets it, that's 1.5 billion people. 1% of them is 15 million people. This is what it means, pandemic. This is what Spanish flu meant. If the virus expands as rapidly as it has in Italy, if the testing kits are not in place rapidly enough, if the population do not feel that they have enough economic and social security to allow them to self-quarantine, then the whole thing can blow up to the scale of Italy, and then there will be panicked reactions in society, and panicked reactions probably by the government. For example, on Sunday, the Italian government said we'll lock down 16 million people, and there was an exodus of people leaving from the region. And then the panicked response was then the next day to announce the whole country's in lockdown. Clearly, they didn't think it through. And that's the type of scenario which could well happen in Britain because of the lackadaisical and laissez-faire attitude the British government's got, which is rooted in the fact that they're calculating on a financial basis how we will deal with the epidemic. And their scientific advice is coming from one side in data and evidence, and that is being merged together into a financial constraint on the dynamics of developing this, because the primary interest is how is this going to affect the economy. To be fair to the Chinese, they've taken a hit for the entire world's population, and they've seen it that way. This is the mindset that's developed within the Chinese population. We are defending our friends, our family, our community, our city, our nation, and the world from a virus that has no immune protection in any human being on Earth. On the 23rd of January, China was locked down. Had they not locked down Hubei and much of China, the disease would have spread rampantly. And so not only have the Chinese succeeded through locking down areas in containing the virus, but their environmental protection measures, such as temperature control, wearing masks, and social solidarity and social awareness of conquering the disease, they call this a people's war against the virus. It's perfectly true that people don't like the idea of a lockdown. They think it might be, oh God, we're emulating totalitarian China. Actually, that's not how the people in China regarded it, and that's not how we should regard it. We're dealing with an epidemic which is uncontrollable at present, except by the type of quarantine measures been introduced in Italy now and in China, and the type of getting ahead, proactive action that needs to be taken to contain and defeat the virus. You're only as safe as the weakest link. So if Britain is saying we're not going to control the borders, how are you going to stop the spread of the disease to other countries from Britain? Reaction and proactive policies. So proactive gets ahead of the situation in order to protect the maximum numbers. Reactive responds to the situation, to the data as it comes in order to stage your actions according to your economic interests. Proactive means you do something to prevent something happening. If a government knows that a virus is coming, then you lay the foundation in advance for what will happen. Now, Wuhan, the Chinese were accused of acting too late, information suppressed and so on, which may well be true. But when they acted decisively, and when they decided to act, they started building hospitals for new capacity immediately. And the problem in Britain is the reactive response is they're not building those capacities in. In London, for example, we have thousands and thousands of empty offices sitting all around the city, which could be converted into emergency treatment centres of one form or another. The technical ability to do this thing is there, but is the will there to take on the interests of private owners of buildings which are sitting empty? And that's why China, of course, has this advantage, because they don't have to worry about that. They will do what is necessary to achieve their objective through their people's war, through popular engagement of the masses and the organisation of the structures of the state if the Chinese are able to conquer the disease in the next few weeks, which it looks like they will, then they should invite in Chinese experts and medics to come and help, offer support inside the communities because they've got the most experience. This is a global virus epidemic, and it must be dealt with globally through international solidarity. We need to establish a sense of social solidarity on a local, national and world scale. Fighting the epidemic requires the active involvement of the mass of working people to try and enforce policies necessary to stop the spread of the disease, whether it be a lockdown, whether it be community assistance and so on. There will certainly be a greater role for the working class, for the delivery drivers, for the health service workers, in any environment where lockdown takes place, where society requires to act collectively to protect itself against this virus. Those people will now become heroes of the country. And of course, in countries like Italy now, the same type of situation is developing. The consequence will also be the emergence of a new social solidarity within the population. I've known these filmmakers for 20 years. They've always sought to discover and disseminate ideas that can question the mainstream dialogue and narrative which is being promoted. And so I ask you to donate to Double Down News. They don't get funding from anybody. It's worth paying something to help disseminate alternative views about the world.